Last week, we discussed the overuse of antibiotics and how it's led to a growing worldwide resistance to many of these medications. While millions of people take these drugs each year, humans actually aren't the main consumers. By weight, 2/3 of the world's medically important antibiotics are sold for use in food animal production, according to the FDA. It may sound surprising, but Dr. Laurel Redding explains the reason behind this odd finding.
When you think about the number of animals there are in the world compared to the number of people, and when you look at the weight of all of those combined animals, some of which do receive antibiotics, the volume number starts to make a little more sense. In that just there are way more animals than there are humans on this planet, and a lot of them tend to be very large, and so they get larger volumes of antibiotics.
Redding is an assistant professor of epidemiology at the University of Pennsylvania School of Veterinary Medicine. She says antibiotics are used within the agriculture industry for three broad categories. The first is for therapeutic use, like giving the drugs to a sick animal.
And that's analogous to what happens in the human world. We tend to use it to treat a known disease. There's also something that's called prophylactic use. And that also happens in the human medical world. So, for example, if someone's going for surgery or they're getting an implant, they'll get prophylactic antibiotics. There's no infection yet, it's to prevent an antibiotics. So animals get prophylactic antibiotics when there's an anticipated stressor or an anticipated outbreak of disease.
For example, many animals will receive antibiotics before they're shipped somewhere, especially if the transport involves young ones like dairy or beef calves. They have a weaker immune system that Redding says often leads to a respiratory disease when they're moved across the country.
The other category of use is called metaphylaxis. And that's when there's a disease outbreak happening somewhere and we want to prevent that disease outbreak from kind of reaching other herds. So it's kind of in between the two, kind of preventative, kind of therapeutic. There is a fourth category of antibiotic use called growth promotion. That was noticed back in the 60s and 70s that if you fed antibiotics to animals bred for meat, that they would grow faster and make more efficient use of their food. And this is no longer allowed in the United States.
The U.S. ban on antibiotic growth promoters went into effect in 2017, following in the European Union's footsteps. And even with this ban, the agriculture sector is still using more antibiotics than humans. Last week, Dr. John McKillop explained how frequent antibiotic use leads to resistance in humans. But does this also apply in animals?
Any use of antibiotics, whether it's appropriate or not, can result in antibiotic resistance because the bacteria that we're targeting, they will adapt their genetics or they'll transfer genetic material between bacteria to, make sure that they survive this attack of the antibiotic. And so the development of antibiotic resistance, yes, it happens in any species that we apply antibiotics to. It even happens in plants. It's not just humans and animals. It happens in pretty much any living species in the world where we're targeting a bacteria. That bacteria can become resistant to antibiotics.
Because of this resistance factor, Redding says more research has been focused on direct alternatives to antibiotics. Scientists have looked at probiotics, prebiotics, and other treatments that would help the animal heal itself. Unfortunately, none of this research is quite ready to be applied on a large scale. Until then, we'll continue to rely on regulations that help keep the animals and us safe from the negative effects of antibiotics.
So farmers have a limited selection of what they can use. Certain categories of antibiotics, those that are in particular considered highly important and critical to human health. So there are certain classes of antibiotics like fluoroquinolones, that third generation cephalosporins, certain classes of antibiotics that can never be used in food animals. So, we're not like using up our big gun antibiotics to feed cows and chickens. That's not the case. And in fact, if you look at by volume, some of the antibiotics that are used to the greatest extent in animal agriculture aren't even used in human medicine at all.
And though Redding says it's difficult to quantify the risk that this poses to human consumers of meat and dairy, she says it may not be as direct as many people assume. For those who worry about antibiotic residue from the animals ending up in our food, Redding says the farming industry has regulations in place to avoid this cross-contamination.
There are these things called withdrawal times. And withdrawal times are a certain amount of time a farmer has to wait before an animal's meat milk, or eggs can be sold until basically the antibiotic is out of its system. So like you're never going to find any antibiotic residues in any meat products, any dairy products, or any eggs in this country because it's so highly regulated.
So, with all these rules in place, should the risk of antibiotic residue be a factor in our decision when we're trying to decide between organic or conventional products?
Organic is about the production system, right? It's about how animals are produced. It has nothing to do with the final food product. The final food product will be antibiotic free, regardless of how the animals are raised. Like I said, all meat, milk, and eggs in this country, and same like many countries throughout the world, are antibiotic free because, we made that decision early on that we didn't want antibiotic residues in our meat and milk and egg products. And so that regulation has been in place for a very long time now. And it's something that most consumers are not aware of. It's a real point of pride for the agricultural industry that our food products are so safe in that regard.
However, even if there's no trace of actual drugs in the product, there can still be antibiotic-resistant bacteria present. A 2021 study published in Environmental Health Perspectives discovered that organic meat is less likely to include multi-drug resistant bacteria than conventionally produced meat.
Now, that's a concern, obviously, when you are handling raw meat or, when you have the possibility of cross-contamination of raw meat and other foods that are not cooked. But if you're cooking your meat, that should kill any bacteria on it. And then it's kind of almost not even a concern whether it's antibiotic resistant or not, because you cook your meat well, you're not going to have any bacteria on it. But obviously, there is still the possibility of handling raw food, and that can transmit antibiotic resistant bacteria to us as well. So that is still a potential concern, but one that can be very easily managed with good food hygiene practices.
As for milk and eggs, Redding says similar principles apply. Most commercial milk is pasteurized, which kills off any bacteria in it. And though eggs can also contain bacteria, cooking them will get rid of it. Overall, Redding says washing our produce and taking proper care with raw meat will help lessen our exposure to antibiotic-resistant bacteria. You can find more information about Dr. Laurel Redding and all of our guests on our website, radiohealthjournal.org. Our writer-producer is Kristen Farah. Our production manager is Jason Dickey. I'm Nancy Benson. Coming up next week on Radio Health Journal.
These are conditions that are predictable and they're preventable, or they're at least forecastable and reducible by really paying attention to those incredible host defenses located in your gut.
Why you should trust your gut.
Then how can you convince an addict to get help before it's too late?
I had people out to kill me. I had people blew my car up in front of my parents' house. I mean, I was at the point where if I didn't leave to go someplace for help, I would have been killed.
All that and more on Radio Health Journal. I'm Reed Pence, the producer and host of Radio Health Journal. If you like listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
The half-life of caffeine is about 6 hours. And so that means that if you have a double espresso at 4 p.m., at 10 p.m., you still have a single espresso in your system.
Struggling to sleep? These mistakes could be throwing you off. Then,
it is kind of odd, isn't it, that we are so fascinated by these people that we're never going to meet and that we want to talk about them and know the latest thing about them.
The psychology behind celebrity gossip. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Radio Health Journal and Viewpoints on your favorite radio station. And subscribe and listen anytime on Apple Podcasts, Google Play, and Spotify. Also, follow us on Instagram and Twitter at Radio Health Journal.
And that's Radio Health Journal for this week. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.